our country has almost one third of all patients of oral cancer in the entire world. And it is unfortunate that oral cavity, which is so easily amenable to examination by doctors and by patients themselves, is having a lesion that comes to the doctor quite late. It is a potentially curable illness, but life will probably never be the same again. Oral cancers is one of those cancers that are directly related to smoking and tobacco consumption. When we say oral cancers, then it includes cancers of lip, of cheek, of jaw, of tongue, and of floor of the mouth. Oral cancers are sixth most common cancer in the whole world, but as I just said, one third of all these patients are in our country. In our country, every third cancer patient is likely to be suffering from oral cancer. So it is quite common and quite big a problem. Today we shall try to discuss the reasons for this cancer, how we can stay away from this, how it is picked up, and how it is treated. Everybody accepts that oral cancer is directly related to smoking. But in our country, smokeless tobacco is a bigger reason for oral cancers. When we say smokeless tobacco, then it is in the form of either pan or in the form of khani, or most commonly these days in the form of ready-made commercially available sachets that have pre-mixed areca nut, lime, condiments and tobacco. They are popularly called Gupta. Many people feel that normal pan is harmless, but actually simple pan also includes slaked lime and areca nut and also the spices which cause repeated injuries to lining of cheek and lip. These repeated injuries later on can take the form of cancer. People at high risk who are consuming all these things should remain alert. Our film industry, the Bollywood, has romanticized tobacco and smoking for quite some time. There is a very old song, Har Fikr Ko Dhuein Mein Udata Chala Gaya, that was trying to normalize smoking. It means that every worry of the life was going up in the air with the smoke. There was one Bollywood song recently that was something like this: Ragad ke khani muh mein dal, fir khani ka dekh kamal, means rub tobacco in your hand, put it in your mouth and then see its miracles. This was changed after the censor board objected to this. Oral cancer is one cancer that alerts you, that gives warning signs in many situations. These warning signs can be caught again because it is easily amenable to examination by patient and by doctor. These signals in many situations are pre-malignant conditions just before malignancy. They can transform to cancer if tobacco and alcohol continue, or whatever insult is going on, it continues even after their development. These warning signs can be in the form of a rough patch on cheek. It is a rough white patch. Restricted mouth opening with diffuse whiteness of the mouth is a pre-malignant condition known as submucous fibrosis. Similarly, red patches on the cheek are also dangerous. They also should make one alert. Fortunately, if picked up in time, tobacco is stopped and treatment instituted, then their progression to cancer can most probably be halted. Now, after having discussed the warning signs, let us come to the signs of actual cancer. The cancer of oral cavity, cancer of mouth, generally announces its presence in the form of a small ulcer that refuses to heal despite adequate treatment. So, if the person is non-diabetic and the cause of injury has been eliminated, adequate treatment has been given, but it is not healing, then one should become alert. If a wound on cheek is ignored for a long time, then it can also extend to involve the skin of the cheek. Many a times, a large part of the skin of face is destroyed by cancer. Cancer of the lip also comes in the form of an ulcer. These ulcers typically are seen at the place where a quid of tobacco is kept. Any tooth that is not carious but becomes loose should alert one, as there is a possibility that there might be something sinister lying in the tooth socket. Ulcers on the tongue are generally ignored as aphthous ulcers. Treatment continues, so a biopsy is delayed and they are diagnosed when the disease is not in that early stage. Ear pain is quite commonly seen in tongue cancers that are relatively advanced. The tongue cancers also sometimes lead to difficulty in swallowing and speaking because the tongue has become fixed because of the cancerous disease. Many a times patients of cancers of mouth, they come to emergency with severe bleeding from the site of the cancer. Diagnosis of mouth cancer is established by taking a small biopsy. If the cancer has spread to neck nodes, lymph nodes in the neck, in that case putting a needle and doing a fine needle aspiration cytology, FNAC, from that lymph node also serves the purpose. Once the diagnosis is confirmed, then the next question is how to treat it. The cancers of mouth are treated with surgery and radiotherapy in different combinations. In most of the situations, surgery is done first. This is followed by radiotherapy with or without chemotherapy. Some centers give radiotherapy for early stage cancers, but in most of the situations, surgery is preferred because it gives you exact details of the extent and spread of disease. Also, we can confirm the complete elimination of disease on surgery table itself with the help of frozen section technique. Surgery is also preferred when the disease is close to bone. As I said, most of the patients come to a specialist when the disease is not in that early stage. So most of the patients also need radiotherapy after they have completed their surgery. Chemotherapy may be added depending on the extent of disease. The chemotherapy addition to radiotherapy is done to boost the action of radiation. Addition of chemotherapy will depend on extent of disease, of course. Now we shall discuss the problems of each modality, but before that I would like to say something about the preventive measures. The easiest and most effective preventive measure is to stay away from tobacco in all its forms. Those who smoke or consume tobacco should quit as early as they can. Quitting tobacco will not only keep our mouth safe, but it will also save us from all other tobacco related cancers. As we all know, quitting smoking and tobacco is also very good for your heart and also saves you from respiratory illnesses. If any of the precancerous conditions that we just discussed is noticed in any of your family members, then please meet a doctor, preferably a cancer specialist, immediately. Many of these situations are reversible with treatment, and even if they are not reversible, we can at least halt the progression to cancer provided the person stops consuming alcohol and tobacco and takes the treatment as advised. We all know that oral cancer is treatable, but the cancer of mouth is not as easily treated as we treat fever. This treatment includes surgeries that are big and sometimes they are mutilating. Surgery for oral cancer involves removal of the affected part with affected lymph nodes. Sometimes it necessitates the removal of a part of jawbone also. If it is small, in that case we can take a small part of bone from leg and put it there in the place of the bone that was removed. But still the natural function doesn't come back completely. Plus, not everybody is fit for that major surgery. Radiotherapy and chemotherapy have their problems, as we have already discussed in our previous videos. Since these are big operations, so there can be complications also. The recovery sometimes becomes bumpy, but all these complications settle down. And we should understand that not all patients need that big surgeries. Majority are treated with much smaller surgeries. The smile on the face of this cancer survivor lady should dispel many myths, if not all. Radiation therapy does have some problems, but most of these problems are temporary. Today's radiation techniques, they minimize the side effects like burning of skin or mouth ulcers, dryness of mouth without compromising the efficacy of treatment. Cancer of mouth is one situation where the role of chemotherapy is very limited. Chemotherapy is generally given along with radiation to enhance the action of radiation, to enhance the efficacy of radiation treatment. Many times when the disease is advanced and has gone beyond the scope of surgery, at that time chemotherapy is given to downstage it and to make it operable. Chemotherapy is also given in advanced cancers to provide some relief to the patients. Targeted therapies, they help patients in getting some peaceful time, but the targeted therapies or chemotherapy, they cannot cure an advanced cancer of head and neck. The curative treatments remain either surgery or radiotherapy in different combinations. Surgery and radiotherapy are used in optimal sequencing to ensure best patient outcome. One very important component of treatment is to meet your doctor regularly in follow-up after completion of your treatment. Many times in unfortunate situations, the disease comes back. So if it has come back and it is small, it is localized to one place, in that condition it might be still possible to do a surgery and try to cure the condition. Many people, unfortunately, they restart tobacco consumption, alcohol consumption after completing their treatment of oral cancer. It is a sure shot recipe for disaster. Cancer will almost certainly come back, and more often than not it comes back in incurable form. I had a patient 2 days back who was operated by me in 2003 for cancer of tongue. He completed his treatment, but in spite of suggestions from me and from the family, all the pressures did not work, and he continued to consume tobacco and alcohol. Now 11 years after remaining all right, he has developed another cancer in his upper jaw. So such a patient cannot blame the disease, he cannot blame Almighty also, because both of them gave a very long rope. So the patient can only blame himself. Many times the cancer comes in incurable stage. The incurable cancers are treated with small dose radiation therapies to alleviate their pain. They are given chemotherapy so that the growth is halted. They are given painkillers. Many a times, as I said, the patients come to emergency with severe bleeding. In that condition, the big blood vessels supplying blood to this area have to be tied as emergency. So at the end, it is important to remain away from tobacco consumption in all forms. Avoid or minimize alcohol intake. Seek immediate attention, immediate medical attention if any of the signs discussed here are discovered in any of your family members. It is important to get treated as early as possible to minimize deformities, and it is very important to get treated by a cancer specialist. With all this, I wish all the cancer patients a speedy recovery and wish you all a good health. Thank you.